Itching, streaming, red eyes every spring and summer, and antihistamine tablets that barely touch it. If that sounds familiar, you're not doing anything wrong, you're just missing 2 steps on the treatment ladder. In the next few minutes, I'll walk you through it. I'm Mr. Dilraj Sahota, consultant ophthalmologist in the West Midlands with training from Oxford and Moorfields Eye Hospital. Allergic eye disease is something I manage year-round, from milder allergic symptoms to more severe disease. Today, I'll give you the clinical framework that we actually use. Quick early fact before we start: tree pollen peaks in March and April, and grass pollen from May to July. Knowing which season affects you lets you know when to start treatment before the symptoms start, not after. 3 steps. Let's go. Step 1 isn't a medicine. It's a physical layer that most people skip entirely, and it makes every other step work better. Pollen lands on the surface of the eye and binds with little cells called mast cells. Think of them as tiny alarm triggers on the inside lining of the eyelid. When pollen binds to them, they release histamine, which causes the redness, itchiness, and swelling. Your first job is to stop pollen reaching those cells. Wrap-around sunglasses and a wide brim hat create a physical barrier. When you come in from outside, rinse your face and crucially instill cold, preservative-free artificial tears. They flush pollen from the surface before it binds. Now, a word on antihistamine tablets. They help with nasal congestion and with systemic symptoms, but they also have a systemic drying effect on mucous membranes, which includes the surface of the eye. In patients who already have dry eye disease, oral antihistamines can dry the surface further and make their symptoms worse. They are not the primary tool for eye-specific hay fever. Start 1 week before your known pollen season begins. If you are a tree pollen sufferer, start in early March. Grass pollen sufferers will likely need to start in late April. Wear wraparound sunglasses outside, and when you come inside, instill cold, preservative-free eye drops to flush away the pollen. These alone will help to reduce the load of allergen on the surface of the eye significantly. That's step 1. Step 2 is when the clinical therapy begins, and most people don't know which eye drops to ask for. Step 2 requires a specific type of drop, not the redness relief ones that you get on the supermarket shelf. Those constrict blood vessels temporarily. You need something that works on the immune response itself. The clinical gold standard for allergic conjunctivitis, as supported by the current evidence base, including the TFOS-DEWS framework, is a dual-action topical drop. These combine 2 mechanisms: the antihistamine effect, which reduces the immediate histamine release, the itching and the redness, and a mast cell stabilizer, which provides ongoing reduction in the release of histamine. Olopatadine is a commonly used drop to this effect, and the key is to use them proactively throughout your allergy season, not just on the bad days. Mast cell stabilization takes a couple of days to build up, and intermittent use loses that benefit. Ask for a dual action drop which works as an antihistamine and a mast cell stabilizer. Don't accept simple redness relief drops or anti-itching drops that don't have those 2 properties. Use them twice daily from the start of your season, not just when your eyes feel bad or your symptoms are particularly having a bad day. I want to be clear, I'm not recommending a specific brand, and I don't have any commercial partnerships with any specific type of drop. Please do speak to your GP, optometrist or ophthalmologist before starting any drops, especially if you have any other eye conditions. If this is useful, subscribe, and there'll be more practical eye care guidance coming regularly. Step 3 is the most important one for parents. Don't skip it. I know how exhausting it can be when symptoms persist despite having tried lots of other things. It can disrupt sleep, school. Step 3 is about knowing when to stop self-managing and to escalate care. There is one situation in particular that requires urgent help from a specialist. If steps 1 and 2 are in place and you're still having significant photophobia, which is sensitivity to light, or getting stringy discharge or severe itching, redness and pain, blurry vision, you need an ophthalmology assessment. And we have the tools to examine your eye and treat it. In a specialist clinic, we can prescribe short, monitored doses of steroid drops, which can help reduce inflammation, redness and swelling, and the allergic element of your eye disease. They aren't available over the counter, and they're not for unsupervised use because they can cause side effects like increased pressure inside the eye, and prolonged use can even cause cataract. They are, however, highly effective when monitored and managed appropriately for allergic eye disease. Now, the most important thing I want to say in this video: for children with atopy, asthma, eczema, who develop severe eye problems during the pollen season, please do not rely solely on pharmacy treatment. If a child has intense itching, thick, ropey discharge, severely red eyes, and complaining of blurry vision or rubbing their eyes, then they need to be seen by a pediatric ophthalmologist. It may be more than simple allergic conjunctivitis. They may have vernal keratoconjunctivitis, VKC, or atopic keratoconjunctivitis, AKC. These are different conditions, and they can cause scarring on the surface of the eye and damage the vision. If your child has asthma or eczema and develops these persistent eye symptoms with any of those features, blurry vision, stringy discharge, sensitivity to light or pain, do not manage this at home. Ask your GP or optician for an ophthalmology referral. This is one situation where early specialist input can genuinely make a big difference. For the majority of adults with straightforward seasonal symptoms, steps 1 and 2 are sufficient. Step 3 is a safety net, not a default. 3 steps. Step 1, physical barrier and preservative-free ocular lubricants. Start them before your allergy season commences. Step 2, dual action antihistamine and mast cell stabiliser drops. Use them regularly throughout your allergy season. Step 3, specialist assessment if you have persisting symptoms despite having followed the first 2 steps, and an urgent review if you've got a child with an allergic background that's developing worsening symptoms. Know your pollen season, start early, and escalate if it gets worse. If this was helpful, subscribe for evidence-based eye care advice regularly. Comment below which pollen season affects you the worst, tree or grass or both. I do read every comment. Thank you for watching.